So this short video gives you an overview of ALISS, a local information system for Scotland, and explains briefly what it can do for you and your pharmacy. The ALISS programme is funded by the Scottish Government and delivered by the Health and Social Care Alliance Scotland, the national third sector intermediary for a range of health and social care organisations. The idea for ALISS came out of a series of workshops which were held during 2010. During these workshops, participants were asked to identify what it is that keeps them well. The discussions during these workshops found that people rely, as expected, on things like GP practices and pharmacies. And it was also found that people were heavily reliant on community-based support, such as exercise classes, walking groups, and befriending services to keep well. What became clear is that having access to a range of resources is what is important, and that can include things that are not always defined as support services. Given the diverse range of resources that people rely on to stay well, the participants in the workshops then considered what could be the barriers to them accessing the full range of resources in their local area. One of the barriers discussed is that information about resources is not always findable. For example, a person with diabetes might benefit from a visit to the GP, but could find accessing a yoga class to reduce stress and improve fitness equally beneficial. The only thing is that the yoga class may only be advertised on a poster in the library, and so they may never find out that it exists. To overcome this barrier, information needs to be more findable, and this led to the following suggestions that became the blueprint for ALISS. The first suggestion was that information should all be found in one place. In this case, that place is the ALISS index. And this is accessible at aliss.org, which currently has over 65,000 resources listed to help people live well. The second was that the index should be managed collaboratively. And thirdly, that the index should be searchable from anywhere. ALISS is a mechanism to make information more findable. It operates on the principle of open data, so search boxes and customisable web pages can be added to other websites that enable users to search resources stored in the ALISS index. Some examples are Living It Up, where under the Discover portal you can search for local resources. So here I'm searching for a walking group in Edinburgh. And the results are displayed here. Another example is Integrate, where you can search for activities across Dumfries and Galloway. They do this through their portal, The Living Well, which is here, where you can search by location and keyword. Other examples where we can search the index are the Community Pharmacies Scotland website, which we will come back to in a moment, and also on local GP practice and pharmacy websites. So this diagram illustrates how ALISS works in practice. For example, NHS Forth Valley has an ALISS account and a staff member has heard about a local resource, in this example Falkirk Live Active, through their work in the local community, which is why the community, represented by the people at the bottom of the diagram, is seen here as feeding into the ALISS process. After hearing about this local resource, the staff member at NHS Forth Valley will then add it to the ALISS index, inputting the information that you can see here on the screen. The intention behind ALISS is to make the index available via the many places where people might look for information or interact with another person who might help them find it. So in this example, Falkirk Live Active can now be accessed in a number of different ways, listed here as front ends. So in places like local pharmacies, GPs, schools and libraries, anywhere that accesses the ALISS index. Through entering this information, NHS Forth Valley has made Falkirk Live Active more easily findable for those in the local community. So what does this mean for you and your pharmacy? Signposting is something that pharmacists often do as part of their work in the local community. Take an example of a 40-year-old man who might come into the pharmacy to pick up his prescription for a heart condition. Now, to manage that condition, medication is extremely important, but so is a healthy lifestyle. The man in question may not be comfortable or have considered speaking to his GP about this, but it may come up during his discussion with you in the pharmacy. During this discussion, he may tell you that he has no interest in joining the gym, but would consider becoming a member of a walking group. The only problem is he has no idea how to go about finding groups in his local area. Community Pharmacies Scotland recognises that this type of discussion will regularly take place within your pharmacy, and so has added a search box of the ALISS index to their homepage. So you can go to the Community Pharmacy Scotland website and scroll down where you will see search for local resources. So in this example you could type in for example location, so we could do Glasgow, and topic, so we could do once again walking group, and search the ALISS index where the results will be displayed. So Community Pharmacy Scotland has also set up its members with an ALISS account and added your pharmacy as a resource. Having an ALISS account means that you are able to add and update information listed in the ALISS index. You can access your account at aliss.org. At the time your pharmacy was set up with an account, an email should have been sent to you with a login and password. You can log into your ALISS account by clicking this button here, login. And if you're still having problems accessing your account, you can select Forgot Password, which is at the bottom here, or alternatively contact the team using the email address provided at the end of the video. The benefit of having an ALISS account and your pharmacy listed as a resource is that anybody who searches the ALISS index will be able to find out about the services that your pharmacy provides, and you can add to and update that information when necessary. However, when listing your pharmacy as a resource, Community Pharmacy Scotland provided a generic description of what a pharmacy does. So that description would look a bit like this. So if you have not done so already, it is important that you log into your pharmacy account and update the description of your pharmacy. So you would log in and put in your username and password. You then click on the Resources tab on the left, and then you would go to Browse Your Resources and click Edit. So where possible, ALISS points back to the original source, so you can enter your website here if you have one, for example. You can then add a unique description of the services your pharmacy provides. So I could say something like, Rebecca's Pharmacy is a local family-run business. You could then put in something about your opening hours so that people know when to come into the pharmacy. So you could say it is open from Monday to Friday from 9 till 5, for example. You can then talk a bit about the unique services that your pharmacy provides. So you could say we have a weight loss support group on a Tuesday at 3 PM. And you could also say something about other services. So you could say, and we specialise in helping people stop smoking. You could then say if you offer one-to-one appointments and how to contact you to find out more about this. You can then add tags to the resource, which will make it more findable. So in this instance, you could add pharmacy, you could put in weight loss, and smoking cessation. And that'll mean that people that are searching for those kind of services can find out about those services your pharmacy provides. You could also add in your address here, and if you have multiple addresses, you can add in those there as well. And then you just have to submit this resource by clicking that button there. So as well as updating the description of your pharmacy, you can also add resources to your pharmacy account. For example, you may be running a specific clinic or event that you wish the public to know about. So to add a specific event, you log in and go to the Resources tab again. You would then select Add Resource. So you could say something like Diabetes Awareness Day at Rebecca's Pharmacy. Once again, you can add in your web address so that people can find out more information. And then you would just add a brief description of what the event is. So you could say something like Rebecca's Pharmacy is holding a Diabetes Awareness Day on the 1st of December. If you or a loved one has diabetes and would like to find out more information, about what we can do to support you, please drop in and speak to us. And obviously the event can be anything that you like, this is just an example. You would then add the tags for your event, so you would put in something like diabetes. And you would then put, once again, the address of where your event is taking place. And you can also put a start and an end date, so if it is a one-off event as well. So you could put that in here. And an end date as well. And once again, you would just select submit, and that would then be added to the ALISS index. Any resources that you add to your account will be viewable through your collection of resources. So these can be found here. So you just go to browse your collection, which is this tab here. And you can then see all the resources that you have added to your account. So you can also add any resources to your collection if there are ones that you find particularly useful, even if you haven't added them yourself. So for example, if you are searching the ALISS index and you type in smoking and Glasgow, you will see, for example, the NHS Greater Glasgow and Clyde smoke-free services. You can add this to your collection by clicking this button here, and it will then be displayed under your collection on ALISS. Thank you for taking the time to learn more about ALISS. If you have any questions about how it could help you in your role, please get in touch. We want to make the ALISS index searchable in as many places as possible, wherever people choose to search for resources to improve their health and well-being. If having a free ALISS search function on your website is something you would be interested in finding out more about, get in touch with the ALISS team who can advise you on this using the email address displayed here. Thank you for your time.